Hello people, in this video let us look at the conditions in which ESR can be raised. What is ESR? Erythrocyte sedimentation rate. So if you allow the red blood cells to sit, they will settle down like this. Okay. So you should know how much time how much it will fall, the height. So if it is falling sooner, that means it is kind of the sedimentation is more. So you can understand, right? So that is why the sedimentation rate is more. When can it happen? It can happen in all these conditions that you can mention in the exam if they ask you. Look at this. In systemic lupus erythematosus, yes, are you able to see here? Systemic lupus erythematosus, multiple myeloma, inflammatory diseases like Crohn's disease, inflammatory arthritis, Crohn's disease, at least you remember, inflammatory diseases from a chronic bacterial infection, fungal infection, tuberculosis. Basically, this is very, this is not specific. So, a lot of conditions can have an increased ESR. That's what you should understand. Then, where are we here? Necrotizing bacterial infection, etc., etc. Pregnancy, old age, end-stage renal disease, Sjogren's syndrome, that is all the dryness, right? Ulcerative colitis. So, Crohn's and ulcerative colitis, both you can write. Okay. See what happens when the blood is in your body, right? There will be some charges which will not allow it to clump. But when it is outside like this, these red blood cells can settle down, they can clump. Basically, these forces, the positive, negative forces which are there, they will not work outside the body. So anyways, remember, why does this ESR increase? Why does it settle down more? Why does it aggregate more in these conditions? Because in all these conditions, what happens? There is more CRP. Okay. So, the increase in the concentration of acute phase proteins like CRP, including CRP, is the most common reason for increased ESR in acute phase response. Okay. So, that is the cause for your increased ESR. What is normal ESR, guys? How much should it be? ESR normal range, what should it be? For 1 hour or something, they will say for 1 hour. If you leave it for 1 hour, how much should it fall? Some millimeter, centimeter? Per hour only they are giving actually. 22, 29 they are saying. So they are saying above 100 in which conditions it will be. So basically we do not know from this table above 100. Okay. But definitely you remember that it is increased in all these conditions. Bacterial infection, fungal infection, viral infection, tuberculosis, Crohn's, ulcerative, multiple myeloma, systemic lupus erythematosus, Sjogren's, pregnancy, old age, etc. Remember here what is they have given actually the reference range here. Less than 10, less than 20 they are saying actually. According to Davidson, it's less than 10 and less than 20 for men and women. Okay. Just remember some more things here. Finally, when you look, there is actually arthritis that you should know, rheumatic fever, and even renal cell carcinoma, etc. So that's why they wrote here, is it? End-stage renal disease. Just remember this much, guys.